Hi, everyone, and welcome to our webinar on holistic therapies for fibromyalgia. I'm Nicole from Swing Care, and I'm excited to welcome Lynne Matallana and Dr. Andrea Chadwick today to talk about what we mean by holistic therapies and why fibromyalgia can benefit from a holistic approach to treatment. So just to kick things off, I want to tell you a little bit about our guests. Lynne Matallana is the founder of the National Fibromyalgia Association and was diagnosed with fibromyalgia in 1995. A graduate of UCLA and the London School of Economics and Political Science, Lynne has served as a member of the United States Food and Drug Administration Patient Representative Advisory Committee and is a founding board member of Women with Pain. She is founder and president of Community Health Focus, Inc., and CEO of Pain Tools, its interactive digital health program for self-guided care. And we also have Dr. Andrea Chadwick. She is the medical director of Swing Care and is double board certified in anesthesiology and pain medicine. Her clinical expertise focuses on complex centralized pain syndromes, including fibromyalgia. And she is the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center. Thanks so much to you both for joining.
Thank you.
Thank you so much for having us.
Absolutely. So I just wanted to kind of kick things off by asking, what do we mean when we talk about holistic therapies? I think it's a word that kind of gets tossed around sometimes. And are they the same as alternative therapies or complementary therapies? What are we kind of talking about when we say holistic?
Well, I'll talk a little bit about, what my version of that is. And the holistic, when you think about the word, means the whole person, and that you're not just focusing on one aspect of their life and how to address that with different types of therapies to improve that aspect of their life that is implicated or affected by their pain. And so I view holistic therapy, I think in the classical sense, and I'll let you speak a little bit about it, but it's always been thought holistic is kind of outside the traditional Western medicine norm, meaning alternative or complementary. But I think we now understand a little bit about why holistic care focuses more on addressing not just symptoms, but also additional parts of the patient's pain experience and what they go through on a day-to-day basis that maybe isn't guided by a physician or a typical care extender. So I'll let you speak a little bit about your version of holistic, and then we can kind of jive about what those different therapies might look like.
Well, thank you. So when you talk about fibromyalgia, obviously there are so many people who are dealing with this. The majority are women. And even though we all have very similar pain and other types of symptoms like fatigue and cognitive problems, each person is different. And so that's one of the problems that I think the fibromyalgia community has had, because healthcare providers can help us in many ways, but there's a lot of other things that have just not been successful to get us back to where we want to be, where we can have our lives back. And so I think that I really am proud of the fibromyalgia community, because I think we've pushed very hard for research and for healthcare providers to look at additional things that can help us. And research has shown a lot of other things can be very beneficial. And actually, if you're doing these things that are, considered holistic, oftentimes that complements what your healthcare provider does. So what we feel is very important is that there's we kind of define it as two different types of things that you do outside of your healthcare provider. One would be some type of complementary type of practice like acupuncture or massage. And then the other one is something that you would do on your own, and that's self-care. And one of the things that has really become a big discussion is this idea of whole person health. And that's what you were talking about, was the importance of treating the whole person. And we've recognized, because there are differences between people, that each person may respond differently. And so one of the areas where they can actually do things a little different is in self-care and finding those things that really help each individual. So that's what we've been hoping for. And I've been working towards.
That's awesome. Yeah, I'm always having discussions with my patients. You know, a big part of my job is helping with symptom relief, and whether that's with pharmacologic or other types of therapies. But oftentimes we really like to dig in when I'm seeing my patients in clinic, and I welcome your feedback on whether or not this is good, is to just ask them, you know, how do you get through your days? What helps you on those bad days? What are the things you've been able to identify that help you get through a flare, whether it's taking a nap or taking a hot bath, or maybe it's distraction techniques such as, you know, coloring books, or music therapy or art therapy. Right. So I think a lot of times where the barriers are, at least for us that are seeing patients, is that can take some time to have those conversations, but I think they're really necessary, because, you know, I may be able to ascertain what they've tried and haven't tried. And anecdotally, when I have these conversations with lots of patients, I start to see patterns emerge, or identify things that maybe they haven't tried that I could suggest to them, you know, knowing that each person's different. And I say, hey, I have some patients, this works really great. You could give it a try and see if it helps you. And it's just a really nice discussion to have. It's almost like it's such a different way of practicing medicine than I ever thought I would do, having these conversations about, you know, like, what do you do to relax? But they're really, really important, because so often, you know, and in Western medicine, it's just about a quick fix with a medication, and it's not digging deeper into these very like rudimentary self-care lifestyle things that, as you mentioned, oftentimes make a huge difference when combined with conventional medical therapy.
Well, and what you're saying is the reason why I've been so impressed with you, is because I hear and have talked to literally thousands of patients, and they are starting to say more and more often, I don't have a conversation with my healthcare provider. And I go in and they renew my medication and then I leave. And that's something that our system, it's not the problem of the healthcare provider, it's our system isn't allowing for those discussions. And I think that not only us patients and healthcare providers like yourself, but the government and other organizations are really recognizing that this is a huge problem, that this is part of the reason why we have a chronic pain epidemic, and why there are so many people with fibromyalgia who, breaks my heart, are really depressed and unhappy because they aren't even going to a healthcare provider anymore. And when we did some major surveys, and 97% of family physicians said, yes, self-care is a huge part of what a person needs who's living with fibromyalgia or chronic pain, but I don't have the opportunity or the time or the ability to implement this. And so that's one of the reasons why I've gotten so involved in trying to figure out how we can provide evidence-based self-care to people with fibromyalgia and chronic pain. And I think that this is something that a lot of people believe in, but you know, it takes time for people to figure out how to, because there's always economics involved, you know, it's just a reality. So how do you figure out a way to make these things available, and make them available at a cost, and make them so that the patient actually improves? And I think that there are quite a few of us. Swing Care is one of the companies. I think our company, Pain Tools, is another, who are really stepping outside of kind of the conventional ways and trying to expand that, so that I use this little saying, so we aren't just telling them to be hopeful, we can tell them that we can be helpful for them. And I think that the pandemic has put so many people in such a difficult position. And I just see people who are not only in pain now, but are really emotionally dealing with, you know, this feeling of hopelessness and doubt. And I think that one of the things that I really want the people who are watching this to know is that there are a lot of people who are working really hard to change this. I know you and I both have been on and are on different organizational committees, through the government, and through advocacy groups and things. And there are positive steps that are being made. And part of it is new technology and new understanding. I mean, telehealth was something that was not always accepted, but the pandemic helped it. And so the pandemic didn't do everything bad. It did some really good, excuse me, really good things too. And so I think that the good news is we're identifying where we have failed through treating people with fibromyalgia, and we're learning how to adjust those things and how to make it better. And again, I hate to use the word hopeful, but I am very hopeful for the future.
Yeah, I'm
Lynne,
definitely hopeful as well.
Lynne, I'm wondering if you could share your own experience about how you started kind of exploring holistic treatments and kind of self-care on your own. You've been kind of at the forefront of this as a patient and then also as an advocate. So curious to hear how that experience went for you, and also how you set aside time and made that a priority, because that can be so challenging.
You are so right. I'm oftentimes told, you should practice what you preach. And I have a hard time doing that sometimes. But when I very first really became ill, as you mentioned, back in the mid-90s, we're giving away my age, but I, was not even aware of fibromyalgia. I had never heard the word. And I was, unfortunately, had a surgery, and I woke up during the middle of the surgery. And after that, I had all of these symptoms, and I just went downhill, basically. I was a partner in an advertising agency. I had to quit that. I had been going through infertility, and that had to be put on hold. And I ended up in bed for 2 years, and my life just stopped. I was in agonizing pain. I couldn't sleep. I would hold myself up to try to brush my teeth. I mean, all of you out there that have fibromyalgia know what that feels like. And I had always lived a very active life. And all of a sudden I thought, my life's over. Here I am. I'm still pretty young, and I'm not going to be able to do all the things I've dreamed of and wanted to do. And I saw 37 doctors, all different types, from psychologists to family practice to neurologists. And with each meeting, I would hear less and less about opportunities for getting better, until one day, one doctor said, your life's going to be a living hell. Just get used to it. And I left that appointment obviously in tears, but I'm also one of those people that if you give me a challenge, I'm going to try to overcome it. And so I thought, okay, I'm done. I'm going to just try to figure this out myself. And the things that I found, the first thing that I found that was so helpful was family support. And so many people don't have that. But I was very fortunate because I had family that said, okay, let's figure this out. And so I started out where my husband hired a yoga instructor to come to my house twice a week. And I know not everybody has the financial capability or the ability to do this, but it was the starting of thinking of doing things differently. And she came to my house, and then so I could go to her house, and then I went to the yoga studio. And in between that, I started doing things like walking to the mailbox each day. And it took months to be able to then walk across the street to the park. And so I was doing these self-care things. I was doing these, complementary things with massage and all of that. And I found the things that worked for me and the ones that didn't. But it took me about 7 years to get to a place where I was really fully functioning and being able to sleep and wake up and feel like, wow, I slept last night. And 7 years is a long time for someone to be disciplined and put that effort in. And what I felt was, and this is what we hear from people all the time, you need guidance. You need to know what should I try first? What's most important? What will work for me? How do I track and find out what will work for me? And not just, we kind of call it the Chinese menu where, oh, well, you can do this and you can do that. And so I started to really feel strongly about two things. One was the patients and the healthcare providers and the researchers had to work together. We had to try to figure out how we work together. And at that point, patients felt, they didn't want to have anything to do because they felt the doctors were their enemy. And so the National Fibromyalgia Association said, no, we have to work together. And I think that, our first priority was to get medications that would be approved. We worked a long time on that. And then we realized that those things helped with certain things, but there were still other problems. And so that was when I really started looking at the research and finding out that there is a lot of research on acupuncture and massage and visual imagery and all of these things that are really important to be able to deal with the pain and the fatigue of fibromyalgia. And I think one of the things that we also learned was you have to kind of do this balancing act. And that's where somebody really can benefit from a healthcare provider or a support person, or even a company like Pain Tools that we hope to be able to guide people so that they know when to activate and when to rest and be calm, because and how to get better sleep. That's the key point too. And that's really hard because when you feel good, you push, and then you end up not feeling good. And so then you calm down and then you feel better, and this cycle happens. So helping people to learn, and that's what I had to do. I had to learn when was it important to push and when was it important to pace and to take time. And so when I found some amazing doctors, especially those at the University of Michigan, I know you've talked to Dan Claw and Dr. Dave Williams, who I have been working with very extensively on this concept. We really said, how do we come up with something that can help people learn how to do this? And how do we make sure that they are able to, and you talked about this, Andrea, communicate with their healthcare provider and let them know, Andrea, you're amazing because you ask them if they're doing other things, but how do they share that? And so that's something else that we're working on and thinking about. How do we let these individuals share with their healthcare provider what they are doing? And then I think also, how do they share that with the people in their families, their employers, to let them know, hey, I'm not lazy, I'm not crazy, because that's still such a stigma. And instead tell them, I'm working on this. It may take a little bit of time. This is a journey, but I'm working on it. I have a really good healthcare provider who is working with me. I'm doing the things that I need to do, and I feel like I'm getting better. And the research shows you will get better. And I don't think a lot of people believe that. And it's so important that they realize, if I could do it, they can do it.
Lynne, you're such an inspiration. Every time I hear you tell your story, and I know, you've really just been a trailblazer in the world of fibromyalgia, working with all of the people who are, fighting along with you to get drugs approved and get things pushed through in advocacy. So, to hear your story and kind of brings tears to my eyes, thinking, it makes me sad that you didn't have like that partner and cheerleader in your early days, because I think the point you mentioned is so key. Is it truly is a partnership, or I mean, I'm a clinician. I call myself Dr. Chadwick, but when I'm speaking with my patients, I often feel there's a very, very much a shared partnership in that journey with that patient. That's oftentimes the power dynamic has always historically been, physician makes the decisions, patient has to go along. And I've always ascribed, and I think it again is through my work with Dr. Dan Claw and Dr. Dave Williams, understanding, the patients they have autonomy here. And so there's always that discussion of, and I tell my patients, it's okay to come in here and tell me you're not okay. I think so often patients feel like they have to come in and pretend, and I can tell in their faces when they're like, oh, I've been doing okay. And they're fighting back tears. I'm like, you're not okay. And it's okay to not be okay. And let's talk about what getting better and, where are the areas we need to focus on here. So I'm very just so pleased to be able to have this discussion with you, because we've even had a webinar on how patients can communicate better with their clinicians about their fibromyalgia. It's so multifaceted. I think that's one of the keys here is understanding, this is not like treating type 1 diabetes here. This is so big and complex. And that's where these ideas of multimodal therapy and partnerships and having the support, not only from your clinicians, but your family and maybe your spiritual advisors or the people you work with, that it really, it's kind of like motherhood for fibromyalgia. It takes a village.
I love that analogy. I did have a doctor probably about 5 years into my journey, and he changed my life because he said to me, you can get better. And I looked at it, was the first time I'd heard that. And I said, what do you mean? And he said, if I do my part and you do your part, you will get better. And I can't tell you exactly how much or exactly when, but I can guarantee you will get better. And that was enough to give me that incentive and that knowledge to say, there is something here that I can have some control over, and I can have support from my healthcare provider to make sure that we're bringing the best of both of these worlds together. And I think one of the things about healthcare providers today, they don't necessarily have that viewpoint because they don't have the time to talk about self-care. They may say, go home and exercise. And the person goes, well, what does that mean? And so I think that if there were more tools in the doctor's toolbox so that they know that other people are helping to explain what holistic healthcare is and to explain what are the options and what are evidence-based things, that they will be happier and they will be more willing to take on those of us that are very challenging. I mean, we know it. It's not our fault. It's not anything because we're crazy or we're lazy or anything like that. It's a very complex problem. And I think now from 25 years ago where we're at, it's taken a long time. And I'll never forget, I was at a conference and Dr. Robert Bennett, who was one of the very first researchers in fibromyalgia who changed so many people's lives, I asked him, so how long do you think it will take for us to have a way of really helping people with fibromyalgia? And he said, about 30 years, maybe 30 to 40 years. And I remember I wanted to just burst out in tears because that was not the answer I was looking for. But here we are 26 years later from the day I asked that. And I think we are getting very close to having those answers. And it takes time, unfortunately. So what I'm thrilled about, first of all, is the fibromyalgia community and how they are always willing to get up out of bed and share their stories and try to advocate. And I want them to continue to do that. And I think that when they hear people like you talking, that's going to motivate them, because I think they feel like the medical community has gone away, and that's not true. And I also think that those that are doing research, I mean, they're really working hard to train new doctors to do more research and to figure out ways to help improve our knowledge and our understanding. And it does take time, unfortunately, to get through the system, but hopefully we are getting close. We are at the top of the mountain almost. And I'm so excited because I think there was kind of this pause because there were so many doctors who were, practicing in the 80s and 90s, and they then had to retire and move on. And now we're having younger, newer doctors come in who are looking at things differently. Like those original researchers looked at things differently and are working so hard to make a difference. And I just hope that you can continue to share your enthusiasm with other doctors, because we need more people like you.
I'm wondering, you mentioned kind of having more tools in the toolbox, and I love that analogy, and pain tools is kind of named that way. I'm wondering if you could share like one or two kind of tools that you find really valuable, either personally or that you're seeing with other patients. And then Dr. Chadwick, I'll turn it over to you too about what are some of those tools that are non-medication based that we can use to kind of help us work on that kind of shared collaboration with our provider. And I love the example you mentioned about, okay, yes, exercise, but how? Or movement, what does that look like for me? And that's something that we just don't often have a lot of time to talk with our provider about, let alone figure out for ourselves.
Exactly. And I think that most of us usually, I know I had so many people say, my doctor told me to exercise. So I went out and I ran a mile like I used to do. And then I collapsed and was in a flare and was miserable. And I don't want to ever go out and try to exercise again. And so I think that's one of the things is that oftentimes people with fibromyalgia are so interested in getting better that they push too hard, they try hard, and sometimes letting go a little bit or trying things at a slower progression. It may be frustrating, but the slower you do things sometimes, the better. I know in Pain Tools, when we talk to people about doing walking, we have them set a very short, small goal, maybe 5 minutes. And then we have them increase every week by a half a minute. Now that may sound crazy to some people, but isn't it better to do it that way slowly so you don't have that flare and you don't have that time where you're in agony? And I think people think, well, how can that ever help? But it has been shown scientifically, and we've been watching women do this through Pain Tools when we're right now doing our beta, so we're just in the testing phase, and it's been amazing to watch the progression. And I think the things that are probably the most important that we have to focus on are sleep and activity and calming your mind and calming your your whole, like you said, both spiritually, both emotionally, both mentally, and learning how to do those things, because learning how to improve your sleep is many, many self-care tasks. So what we've tried to do is help identify those and guide you through them one at a time. And so, sleep can be something from improving your environment or adding white noise or music or something that could help you. Or we were talking earlier about having our dogs in our bed and maybe changing up some of your habits that aren't as healthy for you, even though it may be a little difficult. So a lot of these things are working towards improving your life to get your quality of life back. And sometimes that means that your pain won't completely go away, but you aren't as cognizant of it. And you are doing things that you understand are, pulling that pain down, but is also helping you to be able to strengthen yourself, to be able to think more about the positive things instead of, it's very easy to get caught up in all the negatives when you are miserable. And so all of these things, but what we feel is you need that assistance, you need that help. You need it from your doctor, you need it from your family, and you need it from yourself. So some of those tools, I mean, there's hundreds of self-care tools that people can use. But I think if you start thinking mostly about being active, calm, and improving your sleep, that's a good start.
Well, and so I'll chime in, I tend to have a multi-tiered approach in my practice. And so, yes, the movement and activity, I don't like to use the word exercise. I think there's a connotation there for patients that can be very overwhelming and almost stigmatizing. But when I focus on those things, again, that pacing you talked about is so important. But you mentioned, and it's even accurate in my clinic, I'm very lucky that I've been given the opportunity to have longer appointments and spend time with patients. But that idea of, living with a good quality of life despite the pain, focusing on one's values, I think sometimes digging deeper into those cognitive beliefs and constructs is more than I have time for in my clinic. And so oftentimes, at least I have the ability in my practice to refer to a pain psychologist where patients can really dig deep into identifying those goals, those values, and then understanding how behaviors and changes in cognitive beliefs can help people actualize their goals that correspond and align to their values. But unfortunately, as you mentioned, a lot of times those types of resources, pain psychologists or behavioral therapists, are either unavailable for patients where they live, or perhaps their insurance may not offer coverage for those things. And so one thing, I've been really just so blessed to be able to partner with Swing Care to be able to provide, that home, that medical home for chronic fibromyalgia care. But in terms of self-care, for being able to access these types of behavioral therapies and interventions, there's emerging therapies such as digital therapeutics that allow these types of interventions, that pain psychologists could do their office, that these are able to be downloaded through an app store and put onto your phone, and patients are able to do it on their own time, which allows them to be able to focus on what they need to live their lives, whether it's work or taking care of their children or parents or whatever. It allows them to be able to access that type of therapy at their hands, and again, address those things like sleep and fatigue on their own terms. And so one of the things that we have through Swing Care, the ability to be able to prescribe a digital therapeutic called Stanza for patients to be able to do those types of behavioral interventions at home. So I believe that's just one of the tools in the toolbox that we have to offer at Swing Care. But I'm really looking forward to seeing how these novel, not only healthcare delivery models, such as Swing Care or other types of telehealth, but also these novel therapies. I never would have imagined in my life that I'd be saying, yeah, patients can do their own treatments through their phone.
I know, it's pretty bizarre.
But these phones have become such a big part of our lives. Why wouldn't we capitalize on the fact that almost every single person has one these days, as a way to potentially deliver care and do so in a way that's evidence-based?
And I'm so glad you brought up, like cognitive behavior therapy and things like that, because pain is both physical and emotional, and you can't separate them. You can't have one without the other. And that's something that is a huge part of the problem, because like you said, it can be very expensive, it can be not available. And so I do see where there are going to be more companies that are going to be able to provide this with licensed professionals and be able to, really help people that are in need. It's interesting because through our research with what we've been doing with self-care, we have people who don't want to talk about the emotional side, and then we have people who are desperate for it. So again, this goes back to the fact that we aren't all the same. And
absolutely,
so being able to offer different things for different needs, I think this is another really important part. And I also just want to add, just because we say that you may want to see a therapist or, a life coach or something along those lines, that doesn't mean you're crazy.
100%. The pain isn't in your head. It's just
Exactly.
Sometimes your head has thoughts and beliefs, or well, everybody's head has thoughts and beliefs,
Hopefully.
I would hope so.
But yes, and I have watched, we've been doing some Zoom meetings with groups of women that are dealing with fibromyalgia. And I mean, they're almost sometimes in tears saying, I can't believe that people still believe that I am faking this, that this is not true. And, I can't imagine, because I've gone through it, but I've also learned that there are so many people that do understand it, and our understanding of pain itself for all sorts of illnesses besides fibromyalgia has grown and has improved, and that's going to, in the long run, help literally millions of people. And so, the research that's being done is critical for us to be able to then utilize that research and help people that are struggling and suffering.
Well, not only the research, but education is just such a big
Absolutely.
piece of this. As often as I can, I ask patients to bring their spouse or their loved one, or perhaps someone who lives with them, to come to our appointments, because I think sometimes, it feels like a little like bubble in that office room. And, patients might share with me, my husband or my spouse just doesn't understand why some days I can't get off the couch to make dinner. And so I see that as an ability that if the spouse or the partner or a parent or a friend can come in and listen in, that then I get to educate that person, and then they might educate other people. But that knowledge really is power. And I do as much as I can with my patients, but also just educating the newer classes of physicians, nurse practitioners, care extenders, everyone who will listen. I will try and tell them about how fibromyalgia is not to be feared. We want to empower physicians and other providers to understand it's not that hard to really open up to treating these patients. Because I think a lot of times when patients are saying, people don't believe it or whatnot, especially in our medical community, I think people just don't understand it. And when you don't understand something, you're not going to want to treat it. And so if we can remove that barrier through education, I have found, at least, when I've given lectures at some of my society meetings that are maybe more interventional, a lot of pain physicians like to do a lot of injections. And I like to come in and say, hey, guys and girls, that doesn't fix everything. And I'll do a talk on low-dose naltrexone or other types of therapies for fibromyalgia. And I'll tell you what, the room is almost always packed and people are interested. I think they just get scared because it's new for them.
And that's what we have said. They don't have enough tools in their toolbox. And it's not all that they aren't available. It's they aren't knowledgeable about them. And I think that that's something that really needs to be addressed. And I do know through the pandemic and things, we didn't have the opportunity to do face-to-face discussions and to do some of these things. But now we have to really expand on that. And one of the things that you mentioned is doctors are afraid sometimes. And I think I have a neighbor, he's a pediatric cancer oncologist. And I think I could not imagine having a more difficult job. And yet, because there is this knowledge of what to do and how to help them, there are people that are, have huge hearts and want to do this. And I think about people with fibromyalgia, and I just think, I really see in you I'm trying to think of the right word, but the pleasure isn't quite the right word, but how much you do enjoy helping this group of people who haven't been served appropriately or enough. And if more doctors could understand how much they could feel and have purpose in their practice by helping these people and learning that there are things that they can do. And I think that's part of it. They just don't feel like there's that much they can do. So every time you can speak, please speak.
I do. Anytime I can get a resident or a fellow or a medical student to shadow me in the clinic. I just had a resident yesterday in clinic with me, and she followed up with an email about how she's so inspired to move forward with becoming a pain physician, and that she wants to be able to practice and see fibromyalgia patients and feel, she feels as if it's almost like it was a calling that she was able to come to clinic with me. So, it's about exposure, it's about education. And, I didn't find fibromyalgia, it found me. That's what I say when I talk to my patients and other people about it. But it's truly been like my life's pleasure, honestly, to be able to expand from being an interventionalist to a fibromyalgia physician. And I feel very blessed that through swing care, I've been able to work with very respectable clinicians and professionals and educate them and train them to see patients. And I know our practitioners at Swing Care are just feeling the same amount of passion and calling that I did when I first took it on. So it's been honestly one of the greatest journeys of my life. And I know it honestly kind of feels like it's just getting started.
I know it's just getting started for you and for many others. And people used to ask me, how do you do this? And I said, I get so much back because I get to, talk to and work with and be a part of the lives of so many people who are amazing. Because to me, those people that have struggled through this and still can look back and say, I've learned from this. I feel I'm more compassionate. I'm more, capable. Those things are just absolutely, for me, a gift. And so I know what you're saying is that, well, fibromyalgia found me, that's for sure. And little did I know my whole life would then end up being the path it took. But I am very, very pleased and very, very appreciative that I have had this ability to play a role. And I want to thank you as well for joining our role.
Well, thank you so much for both of you for this great conversation. We're almost at time, but I just wanted to make sure that, with the things that you talked about today, people were able to learn more and find you. So hoping you could just give a 1-minute summary of how people can learn more.
Well, you can learn more by going to the National Fibromyalgia Association, and our website is fmaware.org. Or if you want to learn more about pain tools, the website is thepaintools.com.
Absolutely. And if you are interested in learning more about Swing Care as an option for virtual telemedicine chronic care for fibromyalgia, you can go to www.swing.care. And also I encourage patients to access PubMed, which is our national government's repository for peer-reviewed research. You can go there, and many of the studies that Lynne has spoken about that are some of the seminal works on fibromyalgia are there and are publicly available for patients to be able to read and even share with their healthcare providers as they advocate for their own care.
Yes, thank you so much for bringing that up, because that's something we touched on a lot today, is just having those conversations with your provider and coming in with some of those tools that you're interested in learning more about. I know that we're not often blessed with the providers who do all of that asking for you. So I really appreciate having the resources for folks that are going into those conversations and might be a little frustrated or scared, because that happens to the best of us. So thank you so much again for this conversation. Really, really appreciate it, and look forward to the next one.
Thank you.
Absolutely. Thank you. It's been a pleasure.